Hey guys, Woodruff here. Next, we're going to talk about self-care deficit and elimination issues. So this is another kind of chronic long-term issue that are issues we can see with patients. The difficulties they can have are problems with bowel and bladder continence. Most of the time, they are incontinent. So, which again, when I think about incontinence, then I'm worried about um, them being high risk for infection and skin breakdown. Patients after a stroke, sometimes their body can lose the ability to have the signals or to know when, or sometimes even the muscles in the sphincters for your bowel and your bladder can become weaker. So this can lead to the issues with elimination, but then also these patients in general can have a decreased or lack of ability to perform their activities of daily living that they maybe used to be able to do. So what can we do? Anyway, let me say this. Before we talk about what we can do, let's do a scenario. So a client with a left hemispheric stroke. So again, let's do this. So left hemispheric stroke. So left hemisphere, left brain stroke. That means their right side of their body is weak or right hemiplegia. So the left hemispheric stroke needs a lot of additional assistance with daily activities. How should the nurse approach helping the client with their daily care? So when we get to this chronic state, this is like a rehabilitative state. The thing with self-care is we want the patients to do as much as they can for themselves. So with a patient like this, I'm going to give them assistance as needed, but I'm going to encourage them to do as much as they can for themselves. And I can definitely help them do this and make it less frustrating by giving them devices, simple instructions, and lots of help and therapy to teach them how to adapt and find new ways to care for themselves. So usually, not always, because I don't want to box myself in a corner, but usually when it comes to self-care, the correct answer is going to be something along the lines of encouraging independence and things like that. That always you have to read the question and make sure that it's safe for the person to do that. Why are you? Oh, my thumb's on the screen. Just kidding. So you always want to make sure it's safe for a client to do that. It's not like I'm going to be like, hey, I really want my stroke patient to be independent. So I'm going to just let them they can't move half their body, but I'm encouraging you to get out of bed by yourself. You gotta be smart about it. But whatever they can do for themselves safely, I want them to do. For self-care abilities, they can utilize adaptive devices. Like, for example, they can't squeeze their toothpaste. They might be able to do something like this. Again, look at the nails. That's what I'm just like, what I was bringing up in the last video is just that it's funny that a lot of these like pictures and these devices have these like really like these hand models modeling this stuff when like it'd be much more helpful to see what an actual patient that had a stroke, what their hands look like in these devices. But whatever. Anyway, um, encouraging them to do as much as they can for themselves, like good hygiene, because this is also going to bring back a sense of self-worth. Like after having a stroke, there's a lot of emotional stuff too, but being able to take care of themselves is going to give them a better sense of self-worth, which is going to help with their recovery. Um, and their like mental status. Because like I know for me, like when I've been a few times when I've had to ask for help or had someone help to take care of me, I am miserable. I want to do it myself. And there's just that satisfaction of being able to care for yourself. So the little things make a big difference. I also want to help them, especially like it can go for bowel and for bladder, but we can do what's called bowel or bladder training. What we're going to be doing with that is we're going to be supporting them in by taking them to the bathroom on a schedule. So usually like with bladder training, like every few hours, I'll just get them up to the bathroom, even if they're not sure if they need to go. And it just gets their body kind of on a schedule. And same with bowel training. Sometimes it's just getting the patient up every night at a certain time or in the morning at a certain time and getting their bowels onto a regular schedule. And then always assessing, because even though they can have incontinence, they can also have retention and hold on to things. So I want to always be watching for that. All right, that's it for self-care deficit and elimination issues. See you for swallowing next.